Health is Wealth with Dr. Mike on 105.9 The Region.
You're listening to 105.9 The Region, and this is Health is Wealth with Dr. Mike Carrozza. I'm Station Manager Tina Cortez. Good morning, Dr. Mike. How are you doing on this sunny Saturday?
Good morning, Tina. I'm doing very well, thank you. I mean, we can't complain about the weather for sure, because that's one thing that's been in our favor in this 2020 season. Wouldn't you agree?
Absolutely. Now, we've talked about this before, but it seems to be top of mind once again. People are still stressed. We're worried about a possible second wave this fall. We're worried about sending our kids back to school. What are you hearing in your clinic?
So it's very interesting. You know, we saw a lot of people let loose, just try to open up their doors, come out. More people are doing things that they haven't done in a while. That's not obviously inclusive of seeing family, and also getting out there to, maybe go to the grocery store. And then now it's interesting because we're seeing almost like a digression. So people are sort of retracting. But one thing that I'd like to let our listeners know, and something extremely important, is to continue the hygiene. Because if you do that, obviously, the hand washing is very, very important. Because if you continue the hygiene, then we can beat this. And we can beat this big second wave that's going to come in. And guess what? I mean, Australia, they're already in their, if you will, second wave, and they have their flu season is well underway already, and because that's their fall. But their numbers are so much lower than they were in the past. And this is because, I believe, with the face masks, the sniffle or somebody that's having that virus is definitely going to be controlled more now than ever before. And a lot of people there's a lot of controversy around this, but this is something I predicted back a few months ago, because there's a lot of people that are just, during the flu season, cold and flu season, they're just coughing. And so you cough in your hand and you shake hands, and there's less handshaking going around now. We can understand this. And people are wearing their masks and they're washing their hands a little bit more. I believe this can be controlled. We just have to remember the principles once we go back indoors, because obviously this is Canada and we do have cold winters, and the fall is coming quickly. And,
absolutely.
So we're going to have to keep up with what we know is going to protect us. And, of course, get as much of this beautiful sunshine as you possibly can by getting vitamin D, because that'll help your immune system. And, but there is a lot of worry. So to just answer your question, people are digressing. I mean, they're getting a little bit more worried. They're worried about their kids. They're coming into the office saying, what should we do with our kids? I believe what the medical professionals have made the decision here in Ontario, and I strongly am a firm supporter of what their choices have been. And that has, kids and children need school. And I believe in that immensely. And especially the younger kids. I mean, the older kids, they can handle it. It's a little bit easier. But the younger kids, they need to have that education. They need to have that social connection. And so, but there's a lot of worry in the mothers out there who just are either going to homeschool their kids, and there's a lot of talk about homeschooling now. There's a lot of people just holding their kids back, and so it depends. First of all, it's all about comfort level, and we don't want to increase anxiety more so than already is for these individuals, and the fear. So especially for moms out there, you want to make yourself comfortable. You have to sort of take this initiative and say, are you going to go with it? Right? And so this is where, that decision comes, because let's say that, the school board is pretty clear on their stance. It's like, hey, you want to homeschool, you want to do online or not? Well, if you're in, you're in. If you're sort of online, you're online. You can't do both, right? And so, and I think putting the kids in school is a good idea, so as long as everybody holds their part of the bargain. And that means, we need a lot of honest parents. If your kid has the sniffles, literally, the slightest sniffles, they got to stay home. And it depends how long they have to stay home for, but obviously, that's going to be important. But, we have to work together as a society and as a community. We have to work together to help one another. And then I believe this is how we're going to control this.
For sure. And I think it's a challenging time for both parents, moms and dads, determining whether to send their children back to the classroom. What recommendations do you have, though, for managing our stress and the anxiety we're feeling about now?
So my advice to people is, A, get outside as much as possible. Deep breathing exercises are going to be instrumental. And taking some really good, one thing that I probably love is L-theanine. Tina, this is a good tip, because L-theanine is, first of all, it's naturally present in green tea, and it's a natural sort of sedative, and it really just calms the body, okay? There's other things that are really good at this as well, things like rhodiola, which is a really good herb and for stressful situations. But of course, talk to your doctor before taking any of these, and we're not recommending any of these medications, but we're just speaking to the research and what works.
All right. After the break, the focus is on CBD. What is it? What are the benefits? Dr. D is back on the show. This is Health is Wealth on 105.9 The Region. Stay with us.
Hi, I'm Miranda Malasani. Health is Wealth with Dr. Mike is brought to you by Nature's Emporium, your neighborhood health food store offering everything natural and organic. Make it your one-stop destination for freshly prepared meals, clean beauty products, nutraceuticals, and nutrient-dense options in every aisle.
You're listening to 105.9 The Region, and welcome back to Health is Wealth. I'm Tina Cortez, and over to Dr. Mike with today's guest.
Thank you, Tina. Joining us on Health is Wealth again today is Dr. Fabio DeStefano. Dr. Fabio DeStefano, thank you for joining us again.
No, thank you, and thanks for having me.
It's always a pleasure to have you on the show. I mean, you're a wealth of knowledge in terms of your research, and I think it's really great to just be able to, obviously you're a chiropractor, you have a wonderful and successful practice, but you love research, right?
Yes. And patients are my biggest incentives when it comes to the research and development, because feedback is everything, and I'm always looking for new ways and how I can strengthen their treatment regimen. And you can attest to this as well, Dr. Mike, in that, we're both of the same mindset that, how do we improve or speed up our patients' recovery? And, this is why we need to be active in research on a daily basis.
Yeah, absolutely. And I think one thing about, your work is, I guess that was your motivation, right? That was your motivation to sort of delve into the nutraceutical space, into the natural medicine sort of realm, correct?
Correct. I mean, I've had, various personal experiences and with diseases, and in particular, going back to 2003 when I was still a student in chiropractic school, and my mother had passed away of this deadly disease we call cancer. And, it further strengthened my passion in the healthcare industry and how to look at more treatment options as an extension of our treatment here in clinic.
Well, it's a tremendous, very, very heartfelt story, and I appreciate that. We're going to talk about something that I think is important, and today's focus is basically, there's a lot of people that are going through, right now with, obviously, September coming, and there's the cold and flu season coming, and then a lot of people are concerned and worried. But also a lot of people are in pain, and because they haven't been moving a lot, let's face it. I mean, there are some people that have just started coming out of the woodworks, if you will.
Right.
And, we want to get people moving, and I'm sure you're instructing this in your practice because this is part about mobility is important.
Right.
And then to support this, I mean, you have a couple of key products. One of my favorite products is the Super 7. Can you talk a little bit about that?
Absolutely, and I'm glad you raised that point, because this has been a terrible time for most people who are staying at home, or they're sitting for prolonged periods more than normal. They have ergonomically incorrect workstations at home. This is what we've been seeing a lot more of, once we got into full regular practice, is increased back pain, increased arthritic symptoms, increased stiffness, you name it. And what has been most of my patients and consumers at large, what has been their saving grace is our Super 7 topical pain relief cream. And I created this for this very reason, not just to help numb symptoms, but also to help speed up recovery, increase blood flow, and reduce muscle and joint stiffness. So it's been doing quite well. I'm so pleased with the results. We get feedback almost on a daily basis, and we're selling across Canada and the U.S. now. So we've been helping a lot of people throughout this difficult time, that's for sure. And so what's unique about this combination is that it's called Super 7 for a reason. I've combined, after years of research, I've combined 7 of the most powerful essential oils, such as Arnica montana, oil of wintergreen, menthol, eucalyptus, peppermint, MSM, and omega-3 oils. And we found this combination to work the best synergistically to help decrease pain, inflammation, and muscle and joint stiffness. So it does have a delivery system, a unique delivery system that helps the active ingredients penetrate the dermal layers directly to the muscle and joint tissue.
And Dr. D, when you joined the show previously, you shared your expertise on turmeric. Can you just remind our listeners about your research in that area?
Absolutely. So, my very first product was a Super 7 because I wanted to help alleviate inflammation and pain externally. What led me to the turmeric was I wanted to sort of complete the anti-inflammatory and preventative regimen as well, and that's what got me onto turmeric. And I was actually studying inflammation as the root of disease quite extensively, and that's now well accepted. So that's what got me onto digging deeper into turmeric research, which we discovered a technology behind our ultraviolet turmeric that helps increase the absorption tenfold and stays in the bloodstream up to 24 hours without any use of additives, which is, to me, is quite phenomenal. That's something that has also been the go-to supplement during this time, as not just to help alleviate pain and inflammation, but also to help prevent any disease. And there are studies showing that the antiviral effects in addition to the anti-inflammatory effects.
And I love that. I love First Full Circle because there's a lot of inflammation on the outside.
Yep.
And then most of the inflammation, including things like cardiovascular disease, arthritis, anything with inflammation actually starts from the inside as well.
Absolutely.
And you pretty much have it all covered at both angles, which is interesting. And one thing I'd like to talk about in terms of the Super 7, why I think it's a lot of people find it favorable, is that they don't have to take a pill, right? They can just put it on topically. And so it's like this transdermal, correct?
Exactly, and really everything we, and I think that we should emphasize the fact that everything we do at Dr. D's is based on absorption, and you're not going to get the full benefit whether it's a supplement or a topical if it's not actually penetrating or it's not getting into the bloodstream. We've done extensive research, years of research with various PhDs and scientists, making sure that everything we create has high bioavailability or absorption so that the consumer, the user, gets the best therapeutic effects. And with the Super 7 in particular, we call it a triple carrier system because we've combined 3 major actives or ingredients to make sure they carry the actives into the tissue so you get targeted pain relief. And that really is the goal with all of these ointments. And unfortunately, there are too many ointments that just numb the area, they just numb the nerves of the skin and sort of create the distraction to the brain. My goal with all of our products, in particular with the Super 7, is to really get to the area of discomfort and the origin of pain.
Yeah, and I think that for our listeners, the bioavailability is a key because not a lot of assimilation is possible, and it depends on the individual. And so when you increase bioavailability for our listeners, is that you basically increase the body's ability to assimilate, if you will, and so to bring up the nutrient and bring it to where it needs to get to. So, for example, the digestive tract is the first route of breaking down some of these vitamins. And so if it's not readily available, meaning that if your gut cannot break it down, it can't get absorbed properly, then you just won't get it to where it needs to act. And I think that's the key to your philosophy, and that's why a lot of your products, I believe, are superior. Now, the Super, no problem, but the Super 7, I think, is, something else is coming out, and I believe, if we could say it, of course, because, I think CBD is a lot of your research right now,
Yeah.
And CBD is a really hot topic right now because, of course, with a lot of the mental health and a lot of the mental illness and anxiety and depression, alongside with having pain, CBD is right up there. Can you just talk to a point basically with respect to CBD and, where it's coming from and how you're going to be including it in some of your products?
Absolutely, I'd love to. Again, going back to how active we are in research, we're always looking at how do we improve. The one thing I should mention is that not only is it quite effective, but the safety behind Super 7 is next to none. I mean, it's been approved by Health Canada, not just for adults, but as young as 2 years of age. And having said that, we thought the next step to increase the efficacy and the therapeutic benefits, it was to add CBD to it. And unfortunately, there's a lot of confusion. I'm sure you can attest to this. Most of the public are really unsure about the benefits of CBD. They don't know the difference between CBD and THC. So we've done extensive research. I worked with various species across the globe, and we thought that combining or adding CBD to the existing Super 7, which we are going to call Super 7 Plus, just takes it to the next level. One thing we see a lot of is neuropathic pain, which is, as you know, one of the most challenging types of conditions to treat. And so whatever we can do from our end to increase the efficacy and the therapeutic benefits. And we've done some preliminary trials, and it's working out quite well. So I'm very pleased with the performance. The chemists that we're working with, they are the best I've ever worked with. The most challenging part of adding CBD to a topical, again, is this issue of absorption. There's a lot of separation with most of the other ointments that are out there, but we've come up with a technology that helps the essential oils blend well with CBD. And in fact, when you combine essential oils with CBD, you get better absorption and the better synergistic effect.
And let's just clarify, what exactly is CBD, and are there side effects? Is it addictive?
Very good question, Tina. So this is these are the most popular questions. So CBD stands for cannabidiol, and so there's cannabis and then there's hemp, right? So most people think it's you only get CBD from marijuana, and most people think that, just like most of my patients, that you always get a high. So when you separate, CBD is really the component, the main active in both of these plants that is used for pain relief, anxiety, nausea, muscle and joint stiffness. So it really is the most important part of the plant. Side effects, there are very few, and actually studies have shown that taking CBD, there aren't any a wide range of side effects. I mean, people have reported maybe some nausea, maybe some headaches, diarrhea, but other than that, there really aren't many side effects that are well documented. But again, when using CBD, the main goal is for pain relief and inflammation, as well as epileptic seizures, muscle and joint pain, arthritic pain. More studies have to be done. Unfortunately, that's one thing that's missing in this this area, is that there are a lot of animal studies that are done, but more human studies need to be done. But again, very pleased to report that there really aren't any too many side effects.
And Dr. D, just to clarify and just to give mention, of course, supporting this initiative and the research and pretty much a lot of the future of your products is the Campacci family and Duroc. Can you talk about that relationship and how that has, definitely, because I know that this is to just contribute to community and get in their steps and try to getting the community healthy and give back as well. But I mean, can you just talk to point on that?
Yeah, I'd be happy to. It's my pleasure. They have been an integral part of our research and development. My hat goes off to this family and to the Duroc company. They are going above and beyond the whole construction industry because they care. They care about the community. The Campacci family has had a strong interest in the healthcare field. so they're giving back to the community by teaming up with Dr. D's, and like I said, they are an integral part of our progress when it comes to our products, and they're really helping us get out to the larger masses because of their significant interest in healthcare and advancing healthcare treatments as well. And so I'd like to give a shout out to Gary Campacci, who was one of our partners, and the Rock family for assisting us in the progression of our research and development and making sure that we have top-of-the-line products. So I thank them immensely for their participation since day one.
Yeah, that's amazing, and it's amazing to have such a local and, of course, York Region's very own, an organization to just think outside the box and really just put, other people before themselves, which is very, very good and wonderful to just have that.
Well, and that's it, because when I first met Gary Campacci, the president of Duroc, it was just extraordinary to see the compassion that he had for his workers and his entire family and community at large, that he wanted to give back and funding some of the hospitals. He believed in my mission and really wanted to help support that. Making sure that we had the best of the best.
Wonderful. And I just want to remind our listeners that, of course, CBD may not be for everyone, but most importantly, check with your doctor. And this right now, is it true that this is probably the only way that patients are going to be able to get the CBD, Dr. D, just to give our patients a little bit about the future in terms of how CBD eventually will come through? But
yeah, there's a lot of confusion right now with how to acquire it. Right now, obviously in Canada, Health Canada has many restrictions on CBD. You get it through dispensaries, through medical doctors who are licensed to prescribe CBD. Laws are changing all the time, and obviously it's different in the U.S. But like you said, speak to your medical doctor, and we will, at Dr. G's, we're always making sure the way we deliver any ingredient, including CBD, has the utmost research behind it, it's the most efficacy and safety behind it. And for example, we're only using the CBD component, the cannabidiol, and not THC. And THC, we should make clear that the THC is the component that gives you sort of the high or the psychoactive effects. We are only concerned with the pain relief and the inflammatory relief substance of these plants. And we are actually using hemp CBD, which has no THC or very, very little of it. If I could make mention again of the current limitations of CBD right now is, again, absorption. There are some studies that show it as low as 6% and as high as 19 or 20% absorption. So this is why most consumers, our patients out there have to take more, and which, as you know, is very expensive to get, even to get a little effect when it comes to pain relief or inflammation relief. So what we are doing is working again with with these great scientists, making sure that we get the best absorption or bioavailability, which then makes it more therapeutically effective. But at the same time, patients don't have to take as much; they can take a fraction and still obtaining a greater effect.
Can I ask you, when you've been here to talk about turmeric, you spoke about the history of this spice, how it's been used by people all over the world for hundreds of years. Do you think, though, with CBD, there isn't that history and that this may be just a craze or a phase?
There actually has been a history, a long-standing history. Again, it was always known as controlled substance. But I think the great thing now is that a lot of the researchers are creating some clarity here as to the therapeutic benefits, and there are a large number of benefits, Tina. Again, it's been known to be sort of to give you this high effect for years, but I think that the focus should be on CBD, and it has been used for years. It goes back thousands of years, actually. But because now it's starting to become more legalized, and we are seeing, through some of the smaller studies, that there are quite a few of the therapeutic benefits. Again, more studies have to be done, but like I said, it has been used for many years.
Well, Dr. D, we know this is wonderful information, and of course, just to echo that, of course, that there was. I remember being at conferences 20 years ago, and people were talking about CBD, and there were scientists here in Toronto that were dedicating their entire research on it. So for sure, this has been something that has been well documented, well researched, and people have been using this for thousands of years. Yep. But great information once again, Dr. D. Just to give our listeners, where can they hear more? Where can they learn more and check out some of your products?
You can also always follow me on Instagram at Dr. Fabio DiStefano. My clinic is located in Thornhill. The name of the clinic is ProMedics Sports Injury and Wellness Center. And they can always reach me at promedics.ca, and that's promedx.ca. And any questions any of the listeners might have, I'm always available and love to reach out and give you more of my research and opinions on different ailments.
That's terrific. Nice to have you back. And Dr. Mike, just before we wrap up the show, if our listeners want to connect with you, how can they do that?
Well, they can reach us at applemed.ca. They can call us at 905-417-4000. We're back in action, which is nice to know. So whatever your needs are, of course, and they can reach us on Instagram at applemedclinic. And they can see our shows. They can watch them on YouTube, and we have them on iTunes as well.
That's terrific. Previous episodes of Health is Wealth on 1059theregion.com as well. Thanks for listening.
Looking for a one-stop shop to eat well and live better? Nature's Emporium has it all. 100% certified organic produce and fresh meals made daily. Visit Giuseppe's Juice Bar and Bistro and shop every aisle for nutrient-dense, allergy-friendly groceries to eco-conscious options. We offer clean cosmetics, and we have York Region's biggest selection of nutraceuticals. Most importantly, we have a team of health professionals in all 4 locations to help you on the road to good health. For more information, visit naturesemporium.com.